for Thursday, April the 28th. We are joined today by our CEO, Nicole Dupuis, and our acting MOH, Dr. Shankar Nesathuri. We will start our session with some opening comments from Nicole Dupuis.
Thank you for joining us this morning. We're excited to share that the WECHU is once again working in partnership with the Ministry of Health to bring another opportunity for our community to get vaccinated against COVID-19. The provincial GoVax bus, which is a mobile vaccine clinic, will be in Leamington next Monday and Tuesday. The GoVax bus is a safe and convenient way to receive a COVID-19 vaccine. The bus will be located in the parking lot of the WECHU's Leamington office at 33 Princess Street in Leamington on Monday, May 2nd from 2 p.m. to 7 p.m. and Tuesday, May 3rd from 11 a.m. to 4 p.m. Walk-ins will be accepted or appointments are available if interested. Appointments can be made using the provincial booking system online at covid19.ontariohealth.ca or by calling 1-833-943-3900 between 8 a.m. and 8 p.m. 7 days a week. Unfortunately, the appointments for the GoVax bus cannot be scheduled through our own local booking system. Vaccines will be available while supplies last for anyone who is eligible to receive their first, second, or booster dose. Pfizer pediatric doses will also be available on the bus. We ask that anyone who is being vaccinated bring their health card if they have one. If their health card has expired, that's okay. Or if they don't have a health card, bring another form of government-issued photo identification, such as driver's license. To find more information about the GoVax bus, you can visit ontario.ca/vaccine bus. We encourage all individuals who are eligible for a COVID vaccine to visit the GoVax bus in Leamington and stay up to date with their vaccination, as this continues to be the most effective way for our community to manage and live with COVID. If you're unable to visit the GoVax bus on Monday, May 2nd or 3rd, COVID-19 vaccines continue to be offered at many pharmacies throughout Windsor Essex, healthcare provider offices or doctor's offices, and pop-up or mobile clinics throughout our region. And those are all posted on our website at wevac.ca, WEVAF. Thank you.
All right, thank you very much, Nicole. We will move into our round of media questions, starting with the Windsor Star.
Dr. Nesathuri, without Ramsey, could you give a summary of what the disease activity is for COVID-19 for the past week, or if there's any trends?
Yeah, I think that one has to look at the overall data together, and the overall interpretation of the data elements, from my perspective, would be that disease activity now in Windsor Essex is about the same as disease activity last week. We continue to recommend people continue with public health measures, including staying at home if you're sick, wearing a mask indoors, wearing a mask if you can't remain consistently 2 meters away from somebody else, to get vaccinated, and be up to date on your vaccine status, and to use judgment about what activities one wants to participate in the context of the risk. And that would be our recommendation at this point in the pandemic.
So the province has extended the masking mandate for certain settings, the long-term healthcare hospital settings. What's your opinion on that?
I think that's good. I think it's a positive that the province is extending those masking requirements to those settings. I think that's one additional strategy for sure.
Thank you.
Any questions from AM 800?
Good morning, Doctor. Just going off Dalton's first question there. Are we making some progress in Windsor Essex? It just looks like the weekly, for the first time in I think about 6 weeks, we're seeing a decrease about 12% in high-risk cases. So, but then the percent positivity remained unchanged compared to the previous week. So are we making progress in Windsor Essex?
Well, we're always cautious at the Public Health Service. I think that the disease activity is about the same. Um, um, the number of people admitted in the hospital yesterday was 60. So I think there's still significant disease burden. It's hard to know when you're at the peak while you're at the peak, and we may be at the peak, but we may not be at the peak. So I think we just have to watch and be cautious as we move forward.
I guess with the drop in cases last week, high risk cases, excuse me, with that 12%, would that factor in Easter weekend, or would we be seeing that in next week's summary?
Yeah, we may see it in next week's data elements. So I think I would look to next week's data to make some judgments about that.
Thank you.
Any questions from CTV?
Yes, good morning. We noticed there were 19 long-term care and retirement home outbreaks. Do you think more measures need to be in place in that sector?
Well, I think there are already a suite of measures in long-term care and retirement homes, which I think are appropriate. I think the more important thing is to think of measures that we can put forth in the broader community. And I think at this point, balancing the risk versus the benefits, I think it'd be worthwhile for a mandate to require masks indoors for some time-limited period of time. I think that's where the additional opportunity is at this point. The other opportunity is for people to be up to date on their vaccines. I think it's only about half of all people that are currently up to date in Windsor Essex. The numbers, we can give you the exact numbers, and there is waning immunity as people get 4 and 5 and 6 months away from their last vaccination. So I think that is also an area of opportunity.
Thank you. And are you still working closely with the homes? I know in other parts of the pandemic, when there were a lot of outbreaks in LTC, that was usually what kind of the role of the health unit to provide assistance. What is your role currently, I guess?
Yeah, we continue to work. The Public Health Service continues to work closely with nursing home and retirement home partners or long-term care home partners and other congregate facilities. We try to provide the best guidance and support that we can from a public health perspective.
Thank you.
Any questions from Blackburn?
Yes, just going off of Melanie's question there, you mentioned that the measures we have in the long-term care and retirement homes appear to be appropriate, but we should maybe look at other things in the community. You mentioned possibly a mandate to mask indoors. Do you mean in the broader public?
Yes, I think that at this point in the pandemic, based on our current level of disease activity, I think it would be appropriate to require people to wear masks indoors for some time-limited period of time. It would be one additional step in preventing the transmission of COVID-19.
Do you mean here, like, are you willing to, is the health unit willing to impose a mandate locally, or are you again waiting for the province to pick that up?
Well, I think for the policy to be effective, I think it has to be a provincial policy, and we hope that the province, or we have recommended to the province to act on that item.
Thank you.
Thank you. We'll go to a round of follow-up questions, starting with Windsor Star.
CBC is here too.
Oh, sorry. Go ahead. You can ask your questions.
Sorry, it's Katie with CBC. I was a moment late. I apologize. I also have a couple questions about the long-term care and retirement homes. I'm hoping you could help me understand. You know, some of these facilities do go into a lockdown at certain points, and I'm just wondering, does the health unit, are you involved when, if there's a lot of cases and there has to be a lockdown?
Well, long-term care facilities work closely with the Public Health Service in managing outbreaks, and we follow the we make recommendations based on the overall provincial guidance and direction.
So that would come from the province then, if they were to go into a lockdown?
And perhaps Nicole can just comment on the operational items.
Yeah, it doesn't come from the province. So just similar to any outbreak and throughout the pandemic, our teams work very closely with all highest risk settings, long-term care, certainly being one of them as it relates to managing an outbreak. That's a one critical function, of the public health unit, and we continue to support that through our public health inspectors, as well as our case and contact managers. They are in regular contact with the homes, and as Dr. Nesathury said, we assist them with implementing and following the provincial guidance. That's the current provincial guidance as it relates to managing COVID-19 and outbreaks within a long-term care and retirement home facility. So if there are, and as well, I should say also long-term care homes and retirement homes may have their own policies, as well as other highest risk settings that go above and beyond what's in the actual current provincial guidance. And again, that would be, within their own health and safety plan that they've created to manage COVID. So, but our team would always be in contact with a facility that's an outbreak on a daily basis, and providing them with the guidance and, again, adherence to the guidelines that are set out by the province.
Okay, thank you.
Sorry about that, Katie. We will go through our round of follow-up questions now, starting with the Windsor Star.
Yes, this might be a little tangential, but we're finally starting to see some spring weather return to Windsor. But at the same time, it's a bit of a weather roller coaster with summer days being followed immediately by winter days. It's also entering into the pollen season with the allergies and so forth. With testing for COVID-19 largely being the responsibility for the public at this point, do you have any recommendations as to how people can navigate some confusion when it comes to symptoms?
Yeah, unfortunately, it's really quite difficult to distinguish between COVID and non-COVID symptoms. So if one has respiratory symptoms, I think it's worthwhile to get tested. The risk benefit, and I know it's very difficult clinically to make that judgment, but I think that if you do have respiratory symptoms, then it's worthwhile to get a rapid antigen test. If you have respiratory symptoms and you feel sick, to stay away from other people so you prevent the transmission of COVID-19. I also think it's worthwhile to wear a mask indoors, or wear a mask if you can't remain 2 meters away from somebody else. But it is a challenge moving forward to distinguish between allergic symptoms and COVID-related symptoms.
Okay, thank you.
Follow-up question from AM 800.
Nicole, this is for you, non-COVID related question. I guess last year, obviously, beach testing results, and this is just looking ahead, beach testing results returned after being put on the shelf there in 2020. With, I guess, the mass vaccination clinic closing and staff shifting around, will there be any programs that were recently, I guess, postponed or canceled being brought back this coming summer? Has any plans, I guess, been in the works to bring, if there were any programs that were shut down the past couple of years?
Yeah, so we do hope to give a bit of an overview actually at our board meeting coming up on, incrementally the items that we will be prioritizing and moving forward with. But you mentioned beach testing, so that is something that, we will be doing again this year, and you're absolutely correct. So we did forego it during the pandemic, at least for one season. As well, our health inspectors who are responsible for that program also, inspect pools, which we know there'll be many pools opening. So there is a lot of work coming up for the summer, and we're just working right now, working internally with the team to determine how all of that will be managed and prioritized while continuing to manage as we've talked about this morning, continuing outbreaks related to COVID, which are, also, it's the same teams that manage both of those. But we are hopeful that we have a good plan to at least incrementally start to bring back.
Thank you.
Yeah, if I could just add to that, there are many things that the pandemic has, we have had to reassign resources away from other public health programs. I think one of the big things to think about is that we have this very important initiative to vaccinate young people for human papillomavirus, or HPV. And in 2018, 2019, across the province, it was about 60% of 12-year-olds were vaccinated. In 2020, 2021, it dropped to 5% and less than 1%. This is from the Federation of Women in Medicine in Canada, and we can forward the exact numbers. The reason that's important is that HPV vaccination prevents cancers, and if we cannot get, and this is the numbers from the task force, if we can't get our vaccination rates up to our target, which is 90%, it's estimated that about 1,750 women will die of preventable cancers by 2050. So we have to get our vaccination programs back to where they were before the pandemic. That includes COVID, but it also includes non-COVID items such as the HPV vaccination. And I think that's one of the things we'll have to continue to work on over this next year.
Thank you for that addition. A follow-up question from CTV.
No, thank you.
Follow-up question from Blackburn.
Nope, I'm good. Thank you.
And a follow-up question from CBC.
Yes, please. Just back to the potential lockdowns at long-term care and retirement homes. There's many advocates and doctors who say that route of containment is detrimental to residents there. And of course, we've talked before about having care partners. Is there any alternatives to that measure that could still allow for residents to be able to see their family members?
Well, the issues about managing outbreaks in congregate settings are complicated, and they're based on provincial guidance. I think there is continuing dialogue about what is the most appropriate way to manage COVID in long-term care and retirement homes in the context of the fact that the vaccination rates among people in their 70s and 80s is quite high. I do think it's worth exploring alternatives, but I think those alternatives or those reformulated management plans have to come with provincial guidance. And I'm hopeful that the province, over a period of time, that we'll get new guidance and we'll implement new guidance related to containment. I think that we could all do our part by getting vaccinated because the exposures that happen at long-term care and retirement home, in part, are a function of the number of people that might visit the institution who may have COVID. And to the extent that that vaccination may have an impact on that, I think that might be helpful as well. But we continue to reevaluate, and I'm hopeful that we'll get revised guidance. And once we get revised guidance, we can implement that or formulate that in outbreak management.
Thanks so much.
Thank you, everybody. That will conclude our session for today. Our next scheduled media briefing is Thursday, May the 5th. Have a wonderful day.
Thank you. We will.
Thank you.
Bye-bye.
Thank you. Thank you.